Anonymous, well, thank you for your question, whoever you are. Do you think we would be better prepared for future pandemics if we transition to own country national PPE productions and some other things around that? There's no question about it that one of the lessons that came out of COVID was we need to bring the control of our supply chains closer to home. That the longer the supply chain, the more vulnerable and the more fragile we are. Like so many things, these lessons get forgotten very, 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 very quickly, and often for economic reasons, just because there's other ways of doing that. Do we consider mental resilience and people's natural fortitude enough? Well, I think, Emma, we've discussed that now, and if anybody wants to come around that. Our friend Ahmed Khalifa coming in from Cairo. In some Middle Eastern governments, no one was prepared for a crisis. I think nobody was prepared for a crisis anywhere. So all the economic damage was added to lockdown citizens' shoulders, just the cost of living and getting through life. And of course, life in Cairo is tough before you even start, let's face it. Also, the terminology of mental health is not existing in terms of the back to normal phase. And I think that's a great point that we have normalized dysfunctionality. If we were prior to COVID 110% dysfunctional, now we're 140% dysfunctional and and normalize that. And then from Pedro, an interesting question. I think, Pedro, you're trying to start the revolution, my friend. How does the panel see the pandemic response may have been undermined by resistance from senior management in different institutions implementing evidence-based driven response measures? ALARP, which of course is as low as reasonably possible, in the oil and gas industry. How do you think that the profit-driven global economy injured the efforts of the crisis management emergency response teams? I'm going to say something there, which I think it went the other way, but for the wrong reasons. People said they didn't trust the vaccines that were coming out because they had been developed in 18 months, where usually it takes 10 years. So how can you develop a vaccine in 18 months? And the answer is, that's how you should be able to do it if you just throw enough money at it. If you throw money at it, it doesn't need to take 10 years. Of course, what then became was, do we have this as a whole of society response and do we share that out? And actually the pharmaceutical companies, for the most, and many others, saw this very, very much a way of boosting their own economic advantage. And so what we saw was a pandemic, just like any other crisis, as being an opportunity for economic gain. But great point, and I'm sure people will discuss that. What is the panel's opinion of the pandemic suffering from past events, causing over-optimism on decision makers? Great point, Dale Edwards. I'm going to let people speak, and then I'm going to come back to that point again. And this chat is disabled for me. Moira, I'm not quite sure. I'm sorry about that. How can this chat be disabled for you? You're in the chat box. You're typing in the chat box. So how can the chat be disabled? I'm not sure how that works. Okay, but we'll come to that. Okay.
There's a separate webinar chat, and then there's the Q&A. So I think she's saying the webinar chat function she can't get to, maybe.
Okay, fine. In that case, I'll check that out. Thank you, everybody. Right, we have plenty. All of our panelists, I think, can see those questions in the chat. Caroline, do you want to take that away and take one or two you'd like to talk?
Yeah, sure. Yeah. There's a couple of things that sort of sprang to mind. I think Anonymous, the first question about sort of supply chain and trying to sort of get a handle on that and take ownership of that. I think that's a really good one. And I think the problem.
Caroline, can I just come in for a point? And my apologies for discussing you. My apologies. The chat was disabled, but now the chat is not disabled. So hopefully the chat is now, my apologies for that. The chat line should be open. Could people put some stuff in the chats and hopefully we can go on there. Caroline, my apologies for interrupting you. Okay, it's now open. Great.
Okay, good. I was just going to say, but with regard to supply chain, I think it's really important that we get a handle on our supply chains. And I think part of the problem here, to the root of your question, is that people don't think in more than one dimension. So think about costs, so it's like, oh, it's cheaper if it's from there. But if you start looking at it from a point of cost, sustainability, and resilience, suddenly the options become different, right? So basically, if you're saying, and also you could do it from an economic perspective, because if you bring things into your country, you would probably be boosting the economy in those areas. So I think it's thinking about those kind of multi-criteria decision making as opposed to just going for something that's the cheapest. And so I think that's where we need to get kind of decision makers around that actually there's a win-win-win-win here, because we're going to have less effect on carbon because we're not getting it from as far away. We're actually going to boost the economy because we're going to generate it here, and actually we're going to be more resilient because we've got more control here, and we're going to make sure that we've got enough. So I think that's the sort of fundamental problem. The other one I was just going to pick up on, I think there was a comment I think the question about evidence-based or lack of evidence-based decision-making by some senior management who are, again, just focused more on profits. And it's quite interesting. I mean, how I try and think about it is, I think value is, and this multi-value kind of thinking is quite critical to this. So it's sort of like, I always think about, well, how can I make resilience palatable? Or because it does drive, being resilient does drive, I think it does make you more profitable and more competitive. And I think we don't talk about that side of resilience enough. So I think there's definitely, we need to get better at saying, well, if you're resilient, you're actually going to be more adaptive, more competitive, and be advantaged. And I think that's a core kind of tenet of organizational resilience. And I think we forget about that. And so I think I think we need to be showing that business case. And part of the work I've been doing, and I think it sounds like Nadine's been doing as well, is being able to sort of quantify that and measure it and do that business case and say, look, it actually is better for your business if you do invest in this. So I think that's really the crux of that one.
It's interesting that we do seem to think as resilience is something that is a cost and disruptor rather than something that is actually value creating.
Yes, it creates
and an enabler.
Yeah.
Sorry?
Yeah, no, it absolutely creates value. It should do. Yeah.
Great stuff. Okay. Excuse me. I'm just trying to I'm not. My mistake. I was trying to multitask. David, don't multitask. You don't know how to multitask. Don't do it. Right, Daniela. Let's bring you in, please.
Well, I have to agree with Caroline regarding the supply chains. We have to focus on sustainability, and we have to focus on the resilience of our systems. And decision makers, I think, struggle a bit to get it in a row, because it's not only for pandemics, crisis, and PPE. It's for regular material like medication, for example, in healthcare systems as well. Very, very important that we bring back the production of medical supplies, medication, and stuff to our countries. It doesn't have to be into the nation. If the European system would work and the European, it would have a lot of advantages to support each other and make each other stronger during, base healthcare system, but also for crisis and future pandemics. Regarding mental health, it's not at the individual person in a society and regarding their resilience. It's very important. We think start at age to help our children their mental health about preparedness and resilience. It's true, because the individuals build the society, but also our governments and our governmental influence line organization support individual, make the individuals more resilient, because without a good organizational and governmental structure, individuals can be resilient. It's between those two in the small organizations. The same for
Daniela. Can you close down your video, because you're breaking up? Maybe if you close down your video, you'll just free up some bandwidth, and maybe that can come through clearer. Try that.
Okay, is it better?
Yeah, that's better. Thanks.
Okay, that's right. I'm not so sure where I was, but I think the main point is it's a synergy between the individual resilience of people in the society and the governmental structures as a whole to build a strong and resilient society, as it is the same in a healthcare system and in a healthcare organization. So organization always supports the individual and the individual supports the organization. It's a synergy between those two.
It's interesting because there are societies which do that. I mean, we think of the Scandinavian societies, for example, being much more egalitarian, much more open, much more supportive. It's very hard because, of course, there was no clear solution to COVID. There, is lockdown the answer? Is not lockdown not the answer? Nobody knows. Should we maintain our economies open? So Sweden tried to maintain its economy open. New Zealand, on the other side, actually went into complete lockdown. From a health perspective, New Zealand really protected its community, but it wiped out its economy. So there are no free hits on this one. Nadine, would you like to come in and share some thoughts on any of the points covered so far?
Thank you, David. I think what I would like to pick up on is that question around overconfidence. So basically, were leaders perhaps overconfident? And the answer is I'm not quite sure whether that has actually been the case. I think at the beginning of the pandemic, nobody really took it seriously enough, and that may have been one of the issues. And then the problem was here, and it became rather big very quickly. In my view and in my experience, there's a very fine line between appearing to be overconfident and not wanting to show incompetence. And I suppose this is one of the things that during our research we perhaps found as well, is that actually conversations around resilience, particularly when it comes to leadership, organizational resilience, are very sensitive. Nobody wants to say we messed it up. And it was quite difficult to actually get access to organizations as well who were willing to talk to us and share experiences openly. So, and of course, that also is reflected in the way in which we have presented some of our case studies, because anonymity is very important here. When people are opening up, so I suppose that's one of the things that I found, is that actually getting people to be open about what is not working very well and where the system isn't working well is quite difficult. And I suppose when we're looking at some of the inquiries that are running, be it the COVID inquiry, be it the post office inquiry, we're seeing the same, that actually people don't want to talk about areas or things that are difficult and where they may not have taken the right decisions, or where practice hasn't been as it should be. So following on from that, basically the panel have talked quite a lot about the need for skill development, and also the questions that were coming through very much around how to prepare people better for crisis, how to build resilience from a young age. And I mean, this is the point that I keep making almost in every webinar. We do need to reimagine our educational systems, and we do need to reimagine curricula. So basically, what does personal development, career development, what does that look like? What does that look like for students who are on a business course? What does that look like for students who are on a on a medical course or any other course? So basically, is there a set of skills which is reasonably generic that actually should be embedded into educational programs? Is there something that can be done at primary school level, at secondary school level? What is a right skill set to develop at university level, so that actually we start to build those capabilities? Because at the moment, I think we're in a space where there are people like ourselves who understand the issues, but we are trying to understand what needs to be done. So how can we actually educate future generations to be better prepared than us for what is becoming an increasingly complex environment?